And we're back at 8:08. Very happy to be joined by Alexis Rodgers, the coordinator for community outreach and education at the Association for Mental Health and Wellness. They're based out of Ronkonkoma. We say a very good morning to Alexis.
Good morning.
Good to have you aboard here. I understand there's 4 locations, right?
There are 4 locations. We have one in Riverhead on Roanoke Avenue, one in Ronkonkoma on Johnson Avenue. We have the Suffolk County United Vets out in Yaphank, and we have a Bohemia site as well.
So the Association, Alexis, for Mental Health and Wellness, give the audience an idea exactly what you guys do. What's the main function as far as this is concerned?
We've recently merged. Our agency was 3 different agencies. It was the Suffolk County United Vets, the Clubhouse of Suffolk, and Mental Health Association. So these have been long-standing agencies in the community for over 25 years, really focusing on mental illness and helping individuals and families suffering with mental illness.
And it's really a serious thing. And you mentioned there's a vets location as well, which I think is so important because we've covered so many stories regarding individuals who have come back from service, cannot get it together from a mental approach for whatever reason, have a tough time kind of dealing with society in general when coming back, and that's a very important, I would think, topic for you guys.
It is a big topic, and I think it's really important. We have a veteran shelter, so it's a shelter for homeless vets. They have a food pantry, and we have a really important peer-to-peer service, P.F. Dwyer project. So it's peers, it's veterans helping veterans. It's a really great project.
Now, are people able to be housed there, or is it just kind of coming in and talking to somebody on a daily basis? How does that all work out?
In Yaphank, it's a homeless vet shelter.
It is?
Yes.
Okay, so there is certainly they're there to be to house, to be fed, to be talked to. Are there people of the medical field there to talk with them 24/7? I mean, how does that work?
They're social workers. They help them with vocation, with education, and really helping them to gain permanent housing, to move away from the shelter into permanent housing.
Interesting. Is there also a chance that maybe find people employment to kind of get back into society, maybe feeling good about themselves? Does that work out in some sort of way? Are there counselors involved in the employment field?
They help them through education and vocational services.
So there's everything there, pretty much.
Yes.
That's in which area now? What town is it? Ronkonkoma or no?
That one's in Yaphank.
It's in Yaphank. Okay. So that's strictly for the veterans there, pretty much, correct?
Yes.
So the other locations really just deal in the general population, just people dealing, with everyday mental trauma, that type of stuff, trying to kind of get them back on their feet as well, correct?
Yes, the 2 locations, one in Ronkonkoma and one in Riverhead, are our PROS locations. Those are for adult mental health and psychiatric rehab. So it's a day program. It really has a basis on classroom and individual focuses, modalities, helping people gain education, socialization, really be able to help them move towards recovery and wellness.
Is it tougher for individuals who have problems from a mental standpoint? Is it tougher for them to kind of feel to integrate themselves into society? Is it tough for them from all your interaction with different individuals? Is it tough as far as just the overall back into society, dealing with everyday type situations? Trying to help people focus. Do you get a lot of that with these people?
I think it's tough because there's a huge stigma with mental illness. People don't really understand what mental illness is, what it looks like, what it feels like. So I think when people are going through a crisis, they have a difficult time gaining care, access to care. It prolongs the time between crisis and care. So then the longer they're away from treatment, the longer they're away from care and recovery, it's harder for them to integrate. Sure.
Gaps in treatment, I would imagine, are not the best thing for one who is going through problems. I mean, I would think it's a kind of a continuous course of treatment if they're going to get better, correct?
It's a lifelong process, recovery. So it's hard when people are not able to gain access to care. We have also a mental health helpline that we have for individuals and families, people in the community looking for services, so they can give us a call at any time and find housing doctors, psychiatrists, social workers, and we get a lot of calls from families and people who just don't know, how do I access services? What does it mean? What is gaining the language to be able to talk, to get into care? It's difficult.
Is there a phone number that we can give out now that people can call?
Sure. Our mental health helpline is 631-226-3900.
Now, this is relatively a new organization, correct? I understand it's actually the result of a merger of three long-standing not-for-profits here.
We just merged in July 2014. Clubhouse of Suffolk and the Mental Health Association have been longstanding mental health associations for about over 25 years.
Interesting. And it really is, you brought up a good point before. I think we're going to take a break in just a minute or so, but there's such a misconception, I think, from people on the outside looking in when they hear of mental illness. They kind of sense things that probably aren't true. But the fact of the matter is you guys kind of really, it really takes a lot to understand one who is, experiencing a lot of problems for whatever reason. It could be, anything in society. It could be a financial situation, depression. We hear a lot about depression these days. But there's a lot out there. A lot of people just don't understand, I would think.
I think it's important that people understand that 1 in 5 adults in a given year will be diagnosed with a mental illness.
Wow. That's incredible. That's a lot.
Yeah.
It really is. That says something about, where we're heading to as a society.
It's really important that we have these discussions and talk about mental illness. And we talk about cancer, we talk about diabetes, we talk about obesity. So why can't we talk about mental illness?
Listen, that's what we're doing today. We're bringing light to it. Alexis Rodgers with us. We'll continue our discussion at 8:15.
LI in the AM, telling Long Island's story on air and online at linewsradio.com.
And we are back at 8:19. We're talking with Alexis Rodgers, coordinator for community outreach and education at the Association for Mental Health and Wellness, based out of Ronkonkoma, with 3 other locations as well. One very important one taking place this weekend, Alexis, on Roanoke Avenue in Riverhead. And you were telling me about this 8-hour training session that'll take place. And it's all about mental health first aid. And that's very interesting stuff. We were talking about the break. Why don't we give the audience an idea what's happening?
Sure. So mental health first aid is just like it sounds. Many people know CPR. They've been certified in CPR. They've been certified in first aid. It's easy to tell if somebody's choking. It's easy to tell if maybe they can't breathe. Maybe they were telling you, I think I'm having a heart attack. You know what to do. You call 911. But what do you do? How do you administer mental health first aid? What does depression look like? What does anxiety look like? What do you do if somebody's having a panic attack? What do you do? How do you talk to somebody if they're expressing they're thinking about or talking about suicide? And that's what mental health first aid is. It's an 8-hour training course that teaches you how to help someone who's developing a mental health problem or experiencing a mental health crisis.
It's fantastic. I've never heard anything like this. You guys actually did something last year on this whole situation, right? This topic, or no?
We did the same 8-hour training. The mental health first aid has 2 modules. It has an adult module and it has a youth module.
Okay.
The adult module is for anyone out in the community who is going to be engaging with adults. The youth module is really geared towards anyone who's engaging with youth in the community, 12 to 18 years old. This training is really geared towards people who are not mental health professionals. It's for anyone in the community. It's for teachers. It's for police officers, EMTs, Girl Scout leaders, Boy Scout leaders, clergy members, people who are going to be talking to people in the community if they're experiencing or noticing something, and how to get them to the help that they need.
It's great stuff. Now, is there a fee attached to this if someone wants to participate? Or
there is a fee. They can go to our website, which is MHAW.org.
Okay.
Go to our events page and register. It's a $75 fee. That includes all of the materials, lunch, and everything you need for the training.
Now, is there any certification there, any documentation that one gets after the training? How does that work out?
Absolutely. After you've completed your 8 hours of training, you will be given a certification of completion to be a mental health first aider.
Very good. It's really tremendous. You know, it's almost like if you are, you know, a certified EMT and you're in the midst of witnessing an accident, you treat people if you're on the scene there, tourniquets involved, whatever. This is interesting to me because if you do notice someone who is having an attack of some kind of panic attack, let's face it, there are people out there who really just don't know how to handle situations. If you are in that area, you could be of some service to somebody who's going through some distress there. That's a great thing.
It's really important that we talk about prevention and intervention before people get to a crisis mode. So you're noticing someone, a friend, a family member, a neighbor, a coworker, somebody who's having an issue, going through something. You really now have these tools in your toolbox to be able to say, I notice something's going on. I'm seeing something that's not typical for you. How can I help? Or here are some resources that I've learned about. Let's do this together. Let's call. It's hand-holding, and that's really important with our community to really become closer.
No doubt about it. I think there's a huge misconception out there as well as far as mental illness. We always, or some might think illness, means that someone is going to be, completely chaotic and disruptive and everything else in society. And people with mental illness, I don't know if this number, where it came from, but I heard this, that people with mental illness are twice as likely to be the victim of violence or a crime than to be the perpetrator in this. Is that true?
That is true.
Wow.
That is true. People with mental illnesses are vulnerable. People see them, that they can take advantage of them. And I think it's important, again, to go back to stigma, and that, and just to reiterate, they are twice as likely to become the victim. That's astounding. That's astounding.
It really is. It's amazing. And also, I want to point out, you also are involved in a children's conference that's coming up next month. I hear that's going to focus on also mental and behavioral health for kids, something the Association for Mental Health and Wellness is kind of making it a top priority there, right?
We run 3 children's conferences per year. We partner with Suffolk County Department of Mental Hygiene. And in April, we'll be having a children's conference focusing on anxiety in children. And that's a huge topic. Dr. Donna Pincus from Boston University will be coming down and holding the conference in Port Jeff on Friday, April 24th.
Well, it's tremendous stuff. Do you find, before we let you go, do you find that most parents who are aware maybe of an issue within the family with kids, do they kind of attack it early on? Where do you find parents stand right now as far as if they have an individual child who might be suffering right now? Do they get help right away? Where do you find everything going here?
I think the parents want to help. They just don't know how. And I think that's all the more reason why parents should be coming to our trainings. Parents should be coming to our conferences. Parents should be visiting our website and looking for services, calling us on our mental health helpline, and really looking for resources and help their children as soon as they can.
Well, listen, it's a fantastic organization, the Association for Mental Health and Wellness. You can go to the website at MHAW.org. If you want to sign up for this weekend, an 8-hour training, very important. Again, the number?
631-226-3900.
Excellent. Excellent stuff. Really great information. Alexis Rodgers is the outreach coordinator, the coordinator here for community outreach at the Association for Mental Health and Wellness. Can't thank you enough for dropping by for a couple of minutes.
Thanks so much for having me.
Excellent. Excellent job. Right now, 8:25.